Chapter 5, Regulations and Standards. Statutes, regulations, and voluntary standards impact every healthcare professional, including those working in the Central Service Department. These laws and guidelines establish minimum levels of quality and safety. The regulatory requirements that must be followed and recommended voluntary guidelines are presented in this chapter. Before viewing this presentation, please read the chapter and review the Central Service terms by referring to the flashcards that you developed last semester. The learning outcome for this chapter is to differentiate between regulations and voluntary versus regulatory standards. Use the flashcards that you created last semester to review the following Central Service terms for Chapter 5 regarding statutes, regulations, and voluntary standards that impact healthcare professionals. The laws and guidelines establish minimum levels of quality and safety. Failure to comply can result in legal action and negative patient outcomes. The terms for review are statute, regulation, standard, regulatory standards, voluntary standards, and best practice. Regulatory agencies. Regulatory agencies that affect procedures in the Central Service Department include the U.S. Food and Drug Administration, FDA, Centers for Disease Control and Prevention, CDC, U.S. Department of Transportation, DOT, U.S. Environmental Protection Agency, EPA, Occupational Safety and Health Administration, OSHA, the Centers for Disease and Medicaid Services, CMS, and state regulatory agencies. The FDA is responsible for ensuring that foods, cosmetics, human and veterinary drugs, biological products, medical devices, and electronic products that emit radiation are safe and effective for public use. The FDA regulates manufacture of all medical devices and requires pre-market clearance of new medical devices, including sterilants, high-level disinfectants, HLDs, packaging materials for sterilization, sterilizers, and quality monitors such as biological indicators. The FDA and other agencies such as the Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid Services function within the Public Health Service of the U.S. Department of Health and Human Services. The FDA medical device classification describes the level of regulation placed on any device depends on how the FDA classifies the device. Class 1 devices include low-risk devices such as handheld, surgical instruments, and ultrasonic cleaners. Class 1 devices are subject to general controls and are exempt from pre-market approval. Class 2 devices include devices such as sterilization equipment and biological and chemical indicators considered to pose potential risks that require a higher level of regulation. Class 2 devices are subject to general controls and special controls. Class 3 devices include the most stringently regulated devices such as heart valves, pacemakers, and other life-sustaining devices. Class 3 devices are subject to general controls, special controls, and must obtain pre-market approval. General controls are basic controls that apply to all devices. They include provisions that relate to adulteration, misbranding, device registration and listing, pre-market notification, banned devices, notification including repair, replacement, or refund, records and reports, restricted devices, and good manufacturing practices. Exemptions apply to certain Class 1 and Class 2 devices that are exempt from pre-market notification. Any device that is exempt must still comply with other requirements, known as regulatory controls, unless the device is explicitly exempt from those requirements as indicated in the regulation for that device type. The FDA provides a list of exempted devices. Special controls relate to performance standards, post-market studies, and specific labeling. Pre-market approval involves rigorous testing and reporting. Pre- and post-market requirements. Unless a device is listed as exempt from regulation, a 510K submission is required for Class 1 and 2 devices. Class 3 devices may require either a 510K or a pre-market approval, PMA. A 510K demonstrates substantial equivalence to a product already on the market, and a PMA requires new device manufacturers to demonstrate reasonable assurance of safety and effectiveness. FDA inspection of the manufacturing facility is required. The FDA also requires instructions for use, IFU, for all devices. The IFU must include instructions for processing, disassembly, cleaning, assembly, disinfection, sterilization, and using the product. FDA Medical Device Reporting Requirements Safe Medical Devices Act mandates healthcare facilities report all, not just serious injury or death, malfunctions to the FDA and/or device manufacturer within 10 days. The MedWatch program allows voluntary notification to the FDA of malfunctions, labeling inadequacies, and ineffective IFU, etc. Remember that MedWatch is one of your CS terms that is defined as Safety Information and Adverse Event Reporting System that serves healthcare professionals and the public by reporting serious problems or suspected to be associated with drugs and medical devices they prescribe, dispense, or use. The FDA has 3 risk categories related to medical device recalls. Class 1 devices pose high risk that the product will cause serious health problem or death, and the manufacturer must notify customers and recipients of the risk. Class 2 devices pose intermediate risk that the product will cause temporary or medically reversible adverse health problem. Manufacturer must notify customers and sometimes recipients of the risk. Class 3 devices pose low risk, and the product is not likely to cause adverse health consequences, and the manufacturer must notify customers. Examples of recent recalls include breast implants, defibrillators, endotracheal tubes, and surgical staplers. The CDC promotes health and quality of life by preventing and controlling disease, injury, and disability, and responding to health emergencies. The CDC is also responsible for developing isolation techniques, the guideline for disinfection and sterilization in healthcare facilities, which is available to you in the resources section of your course materials in Blackboard, and has provided evidence-based recommendations for cleaning, disinfecting, and sterilizing. The DOT is responsible for ensuring fast, safe, and efficient transportation system. DOT laws related to healthcare include transportation of minimally processed instrumentation for repair reprocessing, transportation of radioactive materials, and transportation of biohazardous materials, including requirements for containment, labeling, and packaging. The EPA is responsible for minimizing greenhouse gases and toxic emissions, regulating reuse of solid wastes, controlling indoor air pollution, and developing and enforcing pesticide regulations. The EPA administers 2 acts that are important to Central Service technicians. One act is the Federal Insecticide, Fungicide, and Rodenticide Act, FIFRA, which is related to all antimicrobial products, including disinfectants, sanitizers, and ethylene oxide, ETO. Labeling for all EPA-regulated products must include the ingredients, directions for use, precautions and warnings, directions for storage and disposal, EPA registration number, and the expiration date if needed. The other is the Clean Air Act amendments, which phased out chlorofluorocarbons, CFCs, used in the ETO sterilant and approved alternative use of hydrochlorofluorocarbons, HCFCs. Emission standards for ETO are state regulated, and there are no current federal regulations. OSHA operates under the U.S. Department of Labor and protects workers from occupational illnesses and injury. Central Service technicians should be aware of the following regulations that pertain to your work area. The occupational exposure to bloodborne pathogens standard is covered in more depth in Chapter 6. The standard sets forth comprehensive guidelines related to employee safety and all areas of the facility as they relate to bloodborne pathogens. For CS professionals, this is primarily related to transportation of contaminated items and use of PPE. Guidelines for the use of ethylene oxide sterilization is covered in more depth in Chapter 15. ETO is a gas that is effective in sterilizing heat-sensitive medical devices. ETO is classified as a toxic gas that is classified by OSHA as carcinogenic and teratogenic. The General Duty Clause of the Occupational Safety and Health Act states that OSHA must conduct facility inspections, announced or unannounced, and impose sanctions for violations. CMS is responsible for the operation of Medicare, Medicaid, and the State Children's Health Insurance Program. CMS is one of the agencies that administers the standards of the Health Insurance Portability and Accountability Act. Be sure to review the following CS terms: Medicare, Medicaid, Health Insurance Portability and Accountability Act, HIPAA. As employees of a covered entity, hospital, surgery center, etc., we are usually concerned with the accountability or privacy portion of HIPAA, but as individuals, you should also know about the portability portion. The HIPAA portability provision, as the name implies, is designed to improve the portability of health coverage for people who are changing jobs and make it easier to add family members to the employee's coverage. HIPAA portability applies to group health plans and issuers of group health plans. Failure to follow CMS standards may result in non-payment to facility-paid fines, fewer instrument equipment purchases, loss of employment, and individually paid fines and imprisonment. Examples of infections events that would interrupt CMS payment include retained foreign objects, air embolism, blood incompatibility, stage 3 and 4 pressure ulcers, falls, trauma, manifestations of poor glycemic control, catheter-associated urinary tract infection, vascular catheter-associated infection, surgical site infections such as mediastinoscopy following CABG, following bariatric surgery, following spine, neck, shoulder, elbow, orthopedic procedures, or following cardiac implantable electronic device, CIED, deep vein thrombosis or pulmonary embolism following total hip or knee orthopedic procedures, and iatrogenic pneumothorax with venous catheterization. State regulations often mirror regulations of federal agencies, or they may be more strict than federal regulations. Central Service professionals must always be in compliance by following the regulation that is the strictest. Personnel from state agencies often work with the Joint Commission during surveys, which are often random and unannounced. Examples of state regulatory agencies include the Department of Health Services, Department of Transportation, Environmental Protection Agency, and Occupational Safety and Health Administration. Professional associations may develop and promote voluntary standards that provide a foundation for processes and practices performed in Central Service functions. A brief description of each of the following professional organizations is provided in Chapter 5 of the Central Service Technical Manual, and a hyperlink to the website of each professional association is provided. Please take a few minutes to investigate the mission and functions of each association. Standards and regulations designed to keep both patients and employees safe. Central Service technicians should become familiar with the agencies and organizations that develop the requirements that impact their jobs